My name is Rex Hayden. I've had the pleasure of knowing and working with Dr. Peabody for almost 30 years at this point. 10 minutes with Dr. Peabody and he will convince you that orthopedics is the best field in the world. I think one of the questions that always comes up is he a mentor? He is a mentor and then some. I think, he is somebody who mentors other mentors to be, kind of role models in our field. But it really also extends into kind of professionalism, leadership, areas that extend far beyond just clinical care. And I think that is the impact that I've experienced with him. I continue to be inspired by what he does in that respect. And again, I would strongly argue that I am one of a very large number of people, maybe even a generation of people who feel the same way. One of the most, I would say, singular areas where he has made an impact, and what I think particularly qualifies him as a pillar of the orthopedic field, is that he is arguably one of the chief architects of graduate medical education as it currently exists in orthopedics. I think he's done that through, helping to create CORD and not just creating it, but really supporting and sustaining it. It's now become, obviously, the organization that really speaks for education in our field. It interfaces with all the other, key stakeholders in graduate medical education and helps to coordinate it to make sure that, again, that our learners are really getting the best experience possible to prepare them to become good physicians and hopefully good teachers themselves. He's been an incredible influence on all the folks that have passed through the University of Chicago while he was here. The folks that I've also talked to at Northwestern who have had similar experiences, they all sing his praises and again are incredibly impacted by the work that he has done over the years. So for that, I think he espouses all the ideals that go into why we created the Orthopedic Pillars program. He certainly is one of the most deserving people to receive it.
So I met Terry in 1990 to 1991. He was about my fourth or fifth fellow in orthopedic oncology. I do recall at the time all the patients having very fond memories of him. And if I was not there, some would ask, well, where is Terry Peabody? And I used to say, well, what about me? Don't you care about me? He said, no, he was so wonderful and engaging. And so Terry went back to UC Irvine to start an oncology program there. And I needed a partner, and I thought he was the best of all my previous fellows. And I contacted him, and I was sort of amazed that he would come back because him and his wife are native Californians and have children. But he did, luckily for me. I needed help both clinically and administratively, and I was so fortunate to have recruited him back to the University of Chicago. And that was in 1994. So as I went up and I was past president of the AOA, and we started to reform ourselves into a leadership group. And so part of that reorganization and mission and vision statements is that we had a sort of academic leadership group, sort of the forerunner of the academic programs that the AOA has now. And so I was able to appoint him, or I was the first member of the academic leadership group, and my successor was Terry Peabody. And as you know, everyone knows that was really the forerunner of what is now CORD. So Terry was instrumental, I must say, in the existence and the foundation of CORD as an entity within the AOA. And subsequent to that, he did many things that we both valued, especially in graduate medical education. He was on the ACGMERC for 6 years. He was on the American Board of Orthopedic Surgery. I think he just finished his term of 10 years. And in a very sad moment for me, but good for him and the rest of orthopedics, he became chair of orthopedic surgery at Northwestern. So Terry, I must say, all of his accomplishment is still really the consummate clinician surgeon. He makes connections with patients easily. He does speak Spanish, which is conversationally, which is of huge help. And I must say, the thing that I admire the most is no longer do fellows ask me about my opinion about clinical difficult cases. They always ask Terry, and he always has a very straightforward, modest answer. And so I just watch this, and I'm so proud of his achievements. And I think he's one of the most important people of orthopedic surgery in his era.
My name's Terry Peabody, and I'm just so thrilled and honored to be named a pillar of orthopedic surgery by the American Orthopedic Association, and frankly, shocked to be named a pillar. It's the greatest honor of my career to be considered amongst those that are listed as pillars of orthopedics. To even be a member of the AOA has been one of the greatest honors that I've had in my professional career. And I was proud to serve it as president, academic chair, and with the help of many others who are still involved in the organization and some who have passed on, organized CORD into a reality. For the last decade, I've been the chair of orthopedic surgery at Northwestern University. And prior to that, for the better part of 2 decades, I was at the University of Chicago, where I had the distinct privilege of working with Dr. Michael Simon, also a pillar of orthopedic surgery, and Dr. Rex Hayden, currently a leader in the American Orthopedic Association. Dr. Simon told me his professional goal was to educate a cadre of academic orthopedic oncologists. And I am proud to have been a member of that cadre. I thank him with all my heart for his ongoing leadership, friendship, and support throughout the years. Dr. Hayden was a student, resident, fellow, and colleague. My kids tell me he's the most intelligent man in the world, and he may well be. But I know him to be one of the best human beings I've ever known, genuine and kind. And I want to thank both Dr. Hayden and Dr. Simon for championing this effort. There are a lot of people to thank, and I ask forgiveness for anybody I've left off the list. I thank God for the blessings and graces he's given me throughout the years. Most important has been my wife, Jane, who stood by me since we were 16 years old. And that's no easy feat, let me tell you. She's done her best to make me a better person. She raised great children, often with little help from me. And she's largely responsible for and shares in all of my successes. I was blessed with terrific parents, family, and friends. Thank you all. I also want to thank those partners, colleagues, former residents, and fellows who gave me a whole lot more than I ever offered them. I appreciate your support. To Dr. Hoffer, Dr. Perry, and Dr. Keenan, thanks for inspiring me to do more than just be an orthopedic surgeon. I also need to thank Mac, Lou Bigliani, Peter Stern, Larry Marsh, Ed Henley, and particularly Vin Pellegrini for their support, insight, and counsel throughout the years. Their generosity is much appreciated. I need to thank my friends, former colleagues on the Residency Review Committee and the American Board of Orthopedic Surgery. And thanks to the present and former leadership of the AOA, Tom, Kristen, Jodine, for helping us accomplish our goals and really further the organization. This organization means a great deal to me. I've always been proud to be a member. I participated in Kellogg. I found the RLF to be very rewarding for my residents. And CORD, I think, has been a tremendously impactful group when it comes to affecting our profession and improving the condition of our profession. The American Orthopedic Association is the one organization where people gather who are interested in discussing and debating important questions regardless of their specialty or practice. It uniquely addresses the contract we have with society, how to best provide high quality care and access to care, how to educate the next generation, and how to work with other organizations with different missions effectively and for the common good. This honor is the highest in my professional career. I am deeply thankful for all who supported it, and I appreciate your generosity and kindness. Thank you very much.